Now to America's hospitals, trying not to buckle under the pressure of the outbreak. Hard-hit facilities across the country running out of bed space, supplies deep in the red. One hospital developing a new way to disinfect and reuse masks. Here's ABC's Mona Kosar-Abdi.
Tonight, the massive surge of coronavirus patients slamming hospitals in hard-hit areas coast to coast, many now running dangerously low on critical supplies.
We're short on PPE that a lot of folks are short on around the country. Masks, face shields.
The national shortages of that protective gear, such as N95 masks, forcing doctors to make difficult decisions.
I've never seen anything like this, where we're literally having to hold on to our own masks.
Tonight, authorities predicting we're still several weeks away from the peak of the virus, and some hospitals say they're running out of space.
We are the United States of America. We should not have to be in a position where we have people die simply because we don't have adequate supplies or adequate beds or adequate workforce.
Officials in New York purchasing more than 2 million new masks and 6,000 ventilators, but warn they may need more. The governor says the Army Corps of Engineers will build makeshift hospitals at 4 locations, including the Javits Center in Manhattan. California receiving a shipment of protective equipment today and says it's leasing 2 hospitals to increase the number of available beds. Officials at Nebraska Medicine in Omaha predict they could run out of masks in the coming days or weeks and developed a new way to disinfect and reuse the masks they have using UV light.
UV light damages cells to the point where cells can die and inactivates the virus so that it can't infect anyone else.
Tonight, we're taking you inside a hospital battling the coronavirus pandemic. Ochsner Medical Center in New Orleans showing ABC News how they're using these special respirator masks. They're called PAPRs, battery operated with a special feature. It purifies contaminated air through a filter, then sends that clean air into the face shield. Just one part of the PPE, the personal protective equipment now being used.
We have to safely take care of these patients to protect our healthcare workers, but also make sure that we're still going to have equipment to take care of the patient that's coming in next week and the week after that.
Dr. Grady Creek is a pulmonary and critical care physician. Just like anyone else treating COVID-19 patients, he has to have his temperature checked before he starts. More and more patients are coming in with major respiratory problems, and they're taken into this special isolated area, a process that can take a toll even on the staff.
As healthcare workers, of course, we treat with compassion, and right now we're faced with having to separate these people with these diagnoses away from their families to protect them, to protect their family, to protect the community.
Stress and the emotional toll right there in those healthcare workers on the front lines. Mona Kosar-Abdi joins us, and Mona, Vice President Pence now asking businesses across the country to donate supplies to hospitals.
That's right, Tom. The vice president is asking companies to go into their storerooms and donate any N95 masks to their local hospitals. And we know that several medical television shows, including ABC's Grey's Anatomy, are doing just that. Tom?
Mona Kosar-Abdi for us tonight. Mona, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.